Hello, my name is Björn Mulder. I'm a medical doctor in the Netherlands, and in this video I'd like to explain in English what we do and what prolotherapy is basically, because the last few years we've increasingly helped many English-speaking or international patients. They come to the Netherlands, they usually live or work in Amsterdam, The Hague, or of course Eindhoven is also a big international hub, or Brussels or other countries speaking English. So is this video really necessary, me explaining in English? Well, not really, because most English-speaking patients are very well educated because there's a lot of English content about prolotherapy on the internet already, and there are other doctors who explain it far better than me. So usually the people who come to us have a pretty good understanding of what prolotherapy is, but anyway, I'd like to give you my version of the facts, what prolotherapy is. So prolotherapy is an injection treatment where we inject glucose. In America they call it dextrose, it's basically the same, so glucose, it's sugar. We inject sugar water with a bit of anesthetic to help stimulate the body to heal. So what kind of injuries do we treat with it? We always say ligament injuries, tendon injuries, and some muscle attachments. Usually these are chronic painful injuries that the body just has a lot of trouble with healing because of the poor innate blood supply. You know, if you scratch your skin, there's a lot of blood going there, there's a lot of reparation cells, a lot of blood platelets, a lot of stem cells that migrate to this area to help the body heal. But with tissues like ligaments, tendons, and joint capsules, this is not so much the case. So that's how injuries become chronic, and that's why people come to seek help for it. You know, you can take in medications, you can do corticosteroid injections to help numb the pain a little bit, or numb inflammation, or to suppress it, but it doesn't really heal anything. So in the cases that we can hopefully heal things, we use regenerative injection treatments. And prolotherapy, in my practice, it's really my workhorse. I treat 75% of my patients I treat with prolotherapy. So it's a basic injection treatment, doesn't require any fancy equipment or any fancy machines or medications. It's just basically injection with sugar water. So what does it do? We irritate the area that we want to treat. We irritate it by injecting it, of course, and also needling it a bit. It stimulates the immune system to come to the rescue, to try to heal this area. And what kind of injuries do we do? So we always say, ligament injuries, ligaments love prolotherapy. So ligament injuries are really my favorite. Tendons, they like prolotherapy. We could still help people with tendon problems, although in some cases I try to pivot more towards platelet-rich plasma injections, which tendons really love. But ligaments love prolotherapy. And I'll give you a few examples. Like, we treat a lot of spine pain. So anything spine related is usually a home run. So neck pain, whiplash injuries. You know, you come to the Netherlands, it's been freezing out a little bit in the winter. You take your bicycle and you fall. You hit your neck or you hit your head on the curb. This can happen, you know. It has happened to us too. It can happen to you. Or you have, you're out walking and you slip and you fall into a canal. You hurt your lower back. Something like this. So what happens? So I've got a small model here of the pelvis here. So just to show you what ligaments are and what they look like. They're really these thick bands, and they're really this color. If you open it up, if you cut it open, then you see how the colors are of the body. So then this indicates that there's hardly any blood going there. That's why the color is so grayish, whitish. So you can imagine if there's an injury to this with an accident or a trauma, it can also be through childbirth, for instance. Young women often suffer from this, of course. It can be from long sitting. A lot of people have, especially English speaking, they come to the Netherlands usually for a desk job, so they sit a lot. So a lot of people, they develop pain like to the coccyx, to the tailbone, so to say, or in the lower back. So lower back injuries, they usually do very, very nicely on prolotherapy. And then knee problems, ligament related, tendon related, shoulders. I love shoulders to treat them. And it's also one very, very common injury site, obviously, especially like in throwing athletes, elbow pain, wrist pain, so anything, ankle sprains, anything ligament related, as long as it's not broken, as long as it's not like completely ruptured, then you need a surgery, obviously. I mean, we cannot repair something that's out of each, that can't reach. But if it's stretched out, so these ligaments become loose and unstable, then we can tighten those up with prolotherapy or other regenerative injection treatments. So what about the patients? What are good patients and what are bad patients? Good patients, the younger the better, the healthier the better, I always say. If you sleep well, if you eat well, if you don't smoke, if you don't drink too much alcohol, those are the general rules. People with autoimmune issues, then it gets harder. Rheumatoid arthritis, people who come and we see all kinds of psoriasis plaques, then we know, or people with irritable bowel syndrome, then we know there is some kind of an immune system autoimmune reaction going on. And then it's, for us, it's swimming upstream, really. So then we try to advise our patients, hey, maybe you need a functional medicine evaluation to see what's going on in your gut, what's going on with your immune system. Is this why you are in pain? Maybe this is why your pain is jumping from place to place. Like you've got wrist pain one day and it's in your knees and your ankles the next. So these kind of patterns, these patients have suboptimal results with prolotherapy, because prolotherapy and other regenerative injection treatments, they do require that it's not the injections that heal, it's your own body that heals. So the healthier you are, the better the results can be. Is age a big factor? Yes and no. Vitality is the biggest. So I have patients who are 70 years old who look like they're 45, who act like they're 45, and vice versa, it's the same. Yeah? So I really look more towards vitality. Of course, an 80-year-old who's very strong and very healthy will heal slower than somebody who's 20. That's logical. So this is a little bit about patients. What about safety? It's the most common negative effect of prolotherapy is that it doesn't work. That's usually the worst thing that can happen. And the other risks are very minimal. We try to be very safe with the injections. Of course, you can hit a nerve or hit an artery. Well, hitting an artery or a vein is not so bad, by the way, but you don't want to hit too many nerves. But this is very rare, to be honest. Can glucose or a little bit of lidocaine cause an adverse event? No, it's extremely rare. So it's a very, very safe treatment. And then, of course, the next question is, am I a candidate for prolotherapy? Well, we'll have to check it out. We'll have to evaluate you. You're always welcome to call us on our number or email me. I'll put the email down below in the description. If you have a question, I have some pain in my musculoskeletal system. Can I get treated with regenerative injection therapy? Please let me know. We're always here for you. Thank you so much for your attention, and I'll hopefully see you soon. Bye bye.